The next session is about the interconnection of emotional and physical health. I would like to introduce our panel speakers this morning, Dr. Sanders, Dr. Serwer, and Karen Fountain. Wonderful to see you all this morning. I want to just give a brief background on our panelists, and then we'll get started with our questions this morning. So again, thank you for being here. We'll start with Dr. Serwer, who is the Chief Medical Officer for VitalSolution. Dr. Serwer joined VitalSolution after retiring from the U.S. Navy in 2021. A decorated Navy officer, and he was the recipient of the Senior Master Clinician Award from the Walter Reed National Military Medical Center, the Defense Meritorious Service Medal, as well as several joint commendations and achievement medals. Dr. Serwer has been a practicing physician since 2001, receiving his medical degree from the University of Oklahoma. While serving in the Navy, Dr. Serwer was hand-selected to serve at the U.S. Capitol Office of Attending Physician, where he cared for members of the U.S. Senate, House Representatives, and the U.S. Supreme Court. He has held numerous leadership positions, including working with the Defense Health Agency to refine the cardiology product line through the entire Department of Defense. Dr. Serwer also serves as cardiology product line chair for the National Capital Region, Chief of Cardiology at Fort Belvoir Community Hospital, and Chief of Cardiac Cath Lab at Walter Reed National Military Medical Center. He is passionate about improving health care in rural America and combating healthcare disparity often received in underserved regions of our country. So thank you, Dr. Serwer, for being here this morning. Dr. Randee Sanders is a visionary force behind RLSanders Associates, known as the Woman Executive Architect. She doesn't just dream of breaking glass ceilings, she shatters them with strategic brilliance. Love that. As an esteemed career trainer, Dr. Randee Sanders is on a mission to propel high ambitious women into the echelons of leadership and influence. Through her groundbreaking Design Not Default Academy, Dr. Randee invites a fire within women leaders, urging them to carve their paths, amplify their voices, and wield the power. My gosh, this is so exciting to have Dr. Sanders here, a trailblazer in both the business and higher education arenas. Dr. Sanders thrives on creating systemic shifts and cultivating a culture of empowerment wherever she goes. With her infectious energy and boundless enthusiasm, she's not just changing lives, she's igniting a revolution. And Karen O'Donnell Fountain has been a registered nurse for 15 plus years. Her focus for the last 10 years has been in nursing leadership, rapid response, job accidents, and COVID response leading teams, and departments of medical, surgical, telemetry, critical care, women and children specialties. Karen has a passion for nursing and a strong support for clinicians promoting excellence, patient care, and outcomes while working in supportive healthcare environments. Prior to Ms. Fountain's leadership role, her experience was in critical care, level 1 trauma emergency room nursing in New York. While in the Army and a member, she has organized and operated many fundraisers through the years to include Clothe a Child, Leukemia and Lymphoma Societies, and Albany Medical Center, and the Troy of Science and Nursing and from American Sentinel University, and has a master's in business administration and finance from Aspen University. She is certified in Six Sigma Green Belt, and Ms. Fountain is certified as an AI healthcare from MIT. Welcome, Karen. What an esteemed panel. I'm going to jump right in this morning because I want to make sure we get a chance to hear from all of you. So let's start out with Karen, would you want to tell us a little bit about how you believe the emotional and physical health influence each other?
Yes, so they have a direct impact on each other. You honestly can't have one without the other. It's basically a continuum of your health, mental and physical.
Yeah, directly related.
Correct.
And you know, in the clinical world, as we're looking for indicators on how these things may surface. Can you maybe give us some insights of what this may look like as they interact with each other?
Yes, I think sometimes it can go undetected. You might not know someone who is very physically fit, looks the part, dresses well, is put together, but they may be struggling mentally. So they are definitely intertwined. And someone who is not physically fit may be very mentally cognizant and managing their life well. They just don't have the physical part down.
Well, wonderful. And I think we know that there's probably some misconceptions about the relationship between physical and mental health. And I know that shows up in how we actually are in the workplace as well. I'd love to hear some of the insights as you're thinking about what those could be and maybe misspell some of those misconceptions.
Absolutely. So, one of the biggest misconceptions is that when people talk about stress, the first thing that they always say, well, it's all in my head. They're coming to a cardiologist because they're having symptoms. And those symptoms, a lot of times, are palpitations, feeling uneasy, feeling jittery. Sometimes it's chest pain, sometimes it's shortness of breath. And we have to take those complaints seriously. And when they tell us they're under a lot of stress, that definitely leads us down a specific pathway. That does not mean that they do not have real complaints from real disease and real problems. And so a lot of times, when we talk about stress, let me just back up for 1 second. It's important to differentiate between acute stress, which is neither intrinsically good nor bad, and then chronic stress. Chronic stress is what we're talking about, and that's the day in, day out, high levels of cortisol, high levels of adrenaline, epinephrine, norepinephrine circulating through our system. We also see other hormonal changes with chronic stress. We see higher levels of insulin. We see higher levels of weight gain. We see this drop in thyroid hormone, drop in estrogen, progesterone, and even testosterone. And we see drops in levels of oxytocin. Oxytocin is the love hormone. We see dropping levels of melatonin, which assists with sleep. We see poor sleep, and everything just kind of spirals. And so, as a cardiologist, the first thing that we need to do is obviously identify the issues. Is someone really sick? Is it someone that we need to really press the matter and pursue inpatient admission and work them up for heart attacks? Or is this something that we can work out as an outpatient? But ultimately, addressing only the palpitation, only that pain, is like putting a Band-Aid on a wound. You really got to delve deeper and understand what's truly going on in the situation. So, it's really easy to say that we have to delve deeper in a 10 to 15-minute clinic appointment when you're double booked. It's not always as easy. But I think it's important for people to know that just because they have a symptom and they're under stress does not mean that it's clearly made up. It's not imaginary. Symptoms are there because of a real issue, and it does need to be evaluated.
Yeah, I think some of the things that I've heard just from individuals that I've talked to who have had a heart attack is they didn't even realize they were having a heart attack. It was something that was like indigestion or felt like heartburn. And, I know several folks just said, I just kept on going and didn't even realize it. And I think the awareness of how the symptoms can present is also really important. So I don't know if there's any advice you can give, Dr. Serwer or Karen, as far as what this could be and what you might be some warning signs.
So the first thing I always tell people, if there's something new that you're not used to experiencing, get it evaluated. Don't be cavalier, especially when it comes to chest pains. Now, with a lot of chronic stress, we do get increased gastric acid production. We do get a higher incidence of GI issues, and sometimes the pain they're feeling might be an ulcer. It might be gastroesophageal reflux disease. It might just be heartburn. However, if it's new, get it evaluated. Women do not present the same way that men do. That classic substernal chest pain that people experience with a heart attack, people don't read the textbooks. That doesn't happen all the time.
Mm.
You have sudden onset of new symptoms, please get it evaluated, because I have seen more women and men to that degree, especially those with diabetes that don't present with a classic presentation. They come to the ER with abdominal pain, with heartburn. They just want some antacids, and lo and behold, they're actually having a big heart attack.
Wow. And thank you for that, because I was going to ask if there were some distinctions between men and women, and also that leads into when we're talking about career strategies and how we start to address stress in the workplace. I'd love to hear as well from Dr. Sanders on how should women kind of be thinking about balancing career and their personal so they can kind of avoid some of this stress. Love to hear your insights.
Sure. I want to make sure that you all can hear me.
Yeah, we
Okay,
can very well.
Thank you. I think that's a really good question. And I would challenge people to shift from using the word balance to more integration. Because when you're thinking about balance, think about that. Go back to childhood for a moment. When you're on a seesaw and you're trying to tip one side higher than the other, and that's always going to feel like you're trying to balance something. And I like to, I'd share out to change that word to emotional integration. Okay, when it comes to high demand environments and preventing burnout, we need to truly focus on maintaining our emotional integration, which is self-management. To my panelists, my colleagues here who are sharing out about stress, that creeps up on you. And sometimes we do ignore those particular signs, but you have to proactively look at yourself and take care of yourself and set some intentional barriers. So I would say the first strategy that I would recommend is to prioritize your energy management. And I know that's kind of different than most individuals. Energy tells you a lot. You sit there, you feel a little bit melancholy, you feel happy. These are all feelings. And if you are feeling lethargic, address that. See what may be going on in that space, just as well when you are happy. So it's not just about time management when it comes to balancing and integration. It's about focusing on that energy, prioritizing that. So I would say instead of acting or reacting, excuse me, to every demand, individuals truly need to focus on those high impact tasks. They need to delegate when possible, recognize that everything is not urgent. And I know people say everything is a priority. Everything can't be a priority. We have to prioritize, and we need to prioritize ourselves. So learning to say no is okay to ensure that you're not running into burnout. It's very essential for your overall health and well-being. And just, again, focusing on the self. Focusing on emotional regulation rather than balance. Focus on integrating that because you are a worker, you are a family individual, you are a civic organization member, you are yourself in the spaces and places that you show up. So it's very critical that we be mindful of how to integrate all those components each and every day.
Amazing. And from a nursing perspective, Karen, how do you see nurses trying to integrate? I'll use integrate instead of balance. I'm learning integrate that the management of work and stress. And then I'm going to ask Dr. Serwer about how this looks at is from a preventative approach as well. So Karen, talk with us a little bit about more the nursing side.
So I think from the nursing side, we have a very hard time prioritizing ourselves. I think not just nursing, but I think physicians, anyone in healthcare, we are bottom of the barrel, meaning we do not take care of ourselves. We will work through sickness. We will make sure our family is good, our children, our patients. We worry about everyone else and put ourselves at the very bottom of the priorities. I think that we need to turn that around and we need to start putting ourselves first, because if we are not taking time off from work, taking breaks, eating healthy, think about what you're eating. When you're in the healthcare setting, you're grabbing whatever is there. And most of the time it is junk food. I can't tell you how many bags of chips I've eaten over years because it's the one thing you can get out of the vending machine that's quick. So I think healthcare workers, whether it's nursing, doctors, techs, clerks, transporters in the hospital arena, need to prioritize their self, because if we aren't healthy, we are not able to help those that need us.
Yeah. Absolutely. I think that's the day that we can look back and say, I'm a little bit better at managing my day. It does kind of help us actually physically as well and feel better. I'd like to, we talk about wellness and we look at it from a term of taking care of each other, but ultimately we have responsibility for that. So what are some of the things, whether it's as a leader or individual contributor, how do we, prevent? What are some of the preventative approaches of really taking care of our health?
Right. So
So
just
for,
checking. I'm sorry. Go ahead.
go ahead, Dr.
Oh,
Serwer.
no. I didn't know if that was for
Yeah.
me or for Karen.
Let's start with Dr. Serwer, and then we'll come to Karen, and then I'm going to ask Dr. Sanders as well.
Perfect. So the first thing I would say is early recognition from all parties. Many people will hide it until it becomes, stage 4 metastatic. When, the stage 1, stage 2, stage 3, as things start to build up and dwell, it is suppressed, it is ignored, and things continue to build up. So on an individual basis, early recognition and intervention early on is key. Easier said than done. From a leadership perspective, pay attention to those that are working with you and working for you. Pay attention to the small things, and it might be something as simple as slight drop in productivity. It might be that you notice that they're coming in a little bit later, leaving a little bit earlier. Notice that they are a little bit more withdrawn than normal. Their focus isn't quite what it used to be. These might be very subtle findings. And over time, they will worsen. They will not get better on their own unless an intervention.
Just lost you. That's okay. Let's, well,
I can jump in here really quickly
Yeah.
while Dr. Sewer's mic comes back on. I would say some simple practices, especially for nurses, because it's a high impact job. So, and I know that you are tending to other needs, and I 100% with you, 100% agree with you, Karen, about prioritizing yourself, because if we don't take care of ourselves, unfortunately, we can't pour from an empty cup. And I know the number one goal is to care for others. So some practices you can do, even in your high impact job, is just do some breath work. Take a moment for yourself, even if it's just 2 to 3 minutes, sneak into that break room and do a couple deep breaths. I call them micro breaks. As you're moving from one unit to the next unit or one facility to the next facility, just sit in your car for a moment and just give yourself 5 minutes to listen to your favorite song, listen to your audiobook, just do some breath work and some mindfulness exercises, because that truly helps reset the nervous system. It truly allows you to just take a moment to yourself to recharge in order to pour into others. So the power of the pause is what I like to call it, is phenomenal. Just take a moment and you'll feel a whole lot better. So again, I recognize the high impact demand job, and I appreciate all the work that the healthcare practitioners do, but you have to take care of you in order to help take care of others.
Yeah, I'd like to follow up on that, and I'll come back in a second. On Dr. Sanders, in your programs that you work with leaders, can you speak to some of the things that you are doing to really help leaders, women, kind of put things back in perspective? I'd like to hear more about your specific programs.
Sure. So we focus a lot on psychological safety and the mindset. So when I'm working with women, we focused on high ambitious women who are looking to excel in their careers. And from design, not default, my mantra is you have to first disrupt your life in order to design the life you want to live, in order to disrupt the industry you're going to be in. And that starts with mindset. It starts with feeling safe within yourself as well as the organizations. And I think Dr. Serwer led to this about leaders must create that space for employees to feel heard, to feel valued, to feel empowered, and for them to express their concerns without any judgment. So we work a lot on those type of concepts and skills when I'm working with those women, and it's transferable skills in any industry. So again, I know that we're focusing a lot on healthcare, but definitely in healthcare, you want to know how you can show up each and every day where you can have those healthy conversations and be sure in yourself. You want to, but the only way we can do that is if the culture in itself provides you the opportunity to have those vulnerable conversations. So we focus a lot in those areas, which help women, and I specifically focus on women, to move with authentically in those spaces as their true selves. But I never negate that the culture in itself has to be welcoming of that type of individual, not just women, for anyone to feel safe. And we have to create those psychological safe spaces for those individuals.
I love it. I love that. And I go back to Karen and Dr. Serwer from the physical side. And I know again in clinical it's tough because the schedules are back to back. Many times our clinicians are carrying, a workload of multiple people. What are some of the things that you recommend just in the day-to-day that clinicians should be doing to kind of balance some of this and making sure they're recognizing the signs that could lead to more deeper complications in their health?
So I believe that you need to know your own physical body. You need to recognize when there is a change. If something is off, most healthcare workers will just brush it aside, that'll go away. I think we need to recognize that our body is speaking to us, and then we have to take action on it.
Right.
Very good.
I completely agree. Can you hear me?
Yes.
Okay.
Thumbs up.
I think I'm getting this. I'm going to get the speaker thing worked out. I promise.
No, it's all
Microphone
good.
issue.
Can hear you really well.
So, going back to the core of what actually is going on physiologically with stress, throughout the day, we're being exposed to adrenaline. And these adrenaline levels are rising. It's causing our heart rate to go up, our blood pressure to go up. We're becoming more diaphoretic and sweaty and clammy and anxious. And that's a hardwired response from caveman days when it was fight or flight. If saber-toothed tiger came up to you and was going to attack, you either ran and got away or you got eaten. So this fight or flight mechanism is intrinsic. So how do we understand ourselves to the degree that we can then deal with that? And so what I always tell people is if things are going rough, take 2 minutes, go to the stairwell, walk up and down a couple of flights of stairs, work off some of that adrenaline. If you have another couple of minutes, sit down, meditate, try to refocus. But if you have that adrenaline surging, you got to burn it off because it's going to come out in some way, shape, or form. And a lot of times it gets bottled up and then bad things happen.
I didn't realize
Stairwells are
adrenaline.
excellent places to burn off. Short, couple minutes, go up and down 2 or 3 flights.
Really. Good advice. I didn't realize that, and thank you for enlightening that adrenaline really is what's happening and causing a lot of the angst and the stress. I didn't know
One
that.
component. It's one component. Cortisol is the other. Cortisol is a killer. I could go on and on about cortisol and the effects. And these are all protective mechanisms that we may or may not need in 2025, but they're there regardless. So we have to be aware of them and know how to deal with them.
Before
Denise,
it becomes an event. Yes.
Can I just share out, Dr. Serwer, you are on my tentacles as this kind of going over here. You're hitting all these buzzwords, and I think it's fantastic. And what I absolutely enjoyed in your sharing out is that you are a leader that's modeling the behavior in order to promote it. So if they see you walking up and down the stairwells, that tells that individual, I too can take a moment to take this break. So I love the fact, and I love hearing that you're saying, listen, walk up and down the stairwells, and you're actually doing it, which sends the message, it is okay for you to set this boundaries or prioritize yourself. One thing that I like to share out, and I think this will also resonate with people in the healthcare field, that if I take care of me, for you and you take care of you for me, we're going to be okay. Right. So that means I have to make sure that I'm focused on me. I love that the 2-minute walk from one level to the next is a break.
Yeah. Yeah, actually to get up and physically move. And I know, Karen, you do a lot with nurses as well, both on site and virtually, just to support them in the day to day as well. Any insights that you've seen work really well in practice that you'd like to share?
Yes, so I am definitely a stairway dweller. I'm up and down, so I fully agree with that. And it's nice to have that quiet because you don't see a lot of people in the stairwell, I'll tell you, especially when you're going from the 6th floor up or down. I think that we need to make it okay to say no. I think that there is a stigma that I can't say no when you call me to work overtime or you ask me to go somewhere to do something. And there's a lot of guilt around saying no. Will my position still be secure? Will it be okay? So I think as leaders, we need to be able to say no, and we need to be able to have those that we're leading and nurses be able to say no. They need to be able to say, I need 5 minutes. I need to go to the break room, or I need to step off the unit, which there's just not a lot of time for that. So I think we need to make it okay.
Yeah, I think it's this feeling of always having to help and always having to be on. That gets back to talking about that, what I would call mental talk, that kind of starts to influence what's happening inside. Um, and it is a reframe of how we look at things. And maybe more detail on from the medical standpoint, how that mental self-talk really does influence what's happening inside. You mentioned earlier that people get the sweating hands and they start to get anxious, and then it starts to show up in different ways. Anything else you would like to add to that, Dr. Serwer, really about how those two are really integrated, both the mental and the physical outcomes?
So, I think so it's abundantly clear now how intertwined physical and mental health statuses are. You can, you can't have one without the other. You have to focus on both your physical and your mental. And a lot of times, um, if you only focus on one, you're never going to achieve your goals. Um, I think it is important to have healthy outlets for stress reduction. Um, if you can go outside, you can close the door and you can yell at nothing, and then you come back in and you don't yell at someone who works for you, that's a win. Over time, the wear and tear on the physical health, the higher heart rates, the higher blood pressure, a lot of times more dependence on vices such as alcohol, as self-treatment or smoking. Those obviously lead to catastrophic consequences in the long run. The most important thing that I tell my patients is you have to shift your reference point. We're not talking about making you look good for the beach in 2 weeks or 3 weeks. We're not talking about, making sure that you can, you know, exercise and go to the CrossFit class next month. I'm talking about where do you want to be when you're 80? And to my 80-year-olds, where do you want to be when you're in your 90s? And your 90-year-olds, where do you want to be when you're in your hundreds? Shift your focus to the horizon. Everything else will work out in the short term. Your goals need to be set for long term. And instead of considering things like exercise and medications punishments for bad behaviors in the past, think of them as tools to reach your goals in the future. And just simple shifting of reference points, as Dr. Sanders was mentioning earlier, the way we think has to be fundamentally changed. But by doing a few simple things, by shifting a few reference points, it's amazing what we can accomplish.
Yeah. And I think people get discouraged when they don't see things happen immediately.
Correct. We're very
So
short-term focused.
yeah, Yeah, it's kind of like New Year's resolutions. You know, we all have great intents the first couple weeks, and then after that, when we don't see, like you said, I'm not ready to run that marathon. People are like, "Well, I'll never be ready to run that marathon." And so I love the
Give it.
fact of shifting the mindset, um, and really being able to look long term on how we take care of ourselves and the little wins, right? Um, so as we're looking at the interconnectivity of physical and mental well-being, and I know I'm watching our time this morning as well, I'd love to hear if you have any personal routines or recommendations you would offer to our audience that would help them overall just focus on their well-being.
Sure, I can jump in here. Personally, I live a structured life, and that's why I'm big on structural support, and I lead by example. So for me, every morning I'm up and I'm journaling. I do mindfulness. I do breath work. I love sound bowls. So I throw on a YouTube sound bowl video and I just lay on the floor and just kind of relax and just center on me in order to start my day. And that really helps me. I'm very spiritual, so I have my spiritual connection as well. That plays in, that's part of my routine to get myself. I work in a high impact job on a daily basis outside of being an entrepreneur, also in higher ed and all of the new changes that's happening in higher ed. I'm definitely agile and flexible and always pivoting is what I like to call it. So I have to prepare my mind in order to show up for the people that I lead as well. And as I stated at the top of this conversation, that I lead by example. So what I'm asking of others is what I do for myself. So I want to make sure that I am integrating that flexibility, that I am providing them those hybrid work options or manageable workloads and those realistic expectations to address burnout. I know it's
Yeah.
real. And I know Dr. Serwer said about acute stress, which is part of life, is the chronic stress that we want to kind of eliminate, which takes time for people. So access to wellness programs, I'll let them know about that. Mental health resources. It is okay to not be okay and discuss that with someone because that is part of healing and helping yourself. So those are some of the things that I do to get my day started.
Wonderful.
So I'll jump in next. I think also your bedroom should be a sanctuary. I think no TV. When the first thing I do when I get up in the morning, I make my bed because I was always taught, and through the military, it is your
Yeah.
first task accomplished of the day. My husband and I don't see eye to eye on it. So if I'm away, it never gets made. My side will stay made, but that's my first accomplishment. And then when I go to bed at night, no cell phone. I leave it in the kitchen on the counter. The TV is off and we have a sound machine. So place a little bit of nice soothing because sleep is huge for your mental and physical health. So I start there with my regimen.
That's wonderful. And we're going to hear from a sleep expert a little bit later on today as well to really tie that into our total well-being. So well said, Karen.
I wish that I could follow everything that you both have given out. Those are wonderful recommendations and excellent ways. I try. As a cardiologist, we take care of a lot of issues 24/7. I'm on call a
Yeah.
lot. The phone can't be, it has to be by my bedside. And it's an unfortunate necessity. When I'm not on call, absolutely gotta focus on sleep, focus on rest. The most important thing that I think that I tell people routinely is to make sure you have a purpose. Find a purpose. And and people will derive severe inner peace by working towards that purpose. And it might be a spiritual purpose. It might be volunteering. It might be work. It might be family. But find a purpose.
I think that's great advice, and yeah, I'm sitting here thinking about all the wonderful practical tactics that you are providing. And I trying to think about in today's world where there's so much emphasis on, being empowered and being, successful. And it's really trying to integrate how we see our success as well as including our health. Practically love our cardiologists, but seeing less of them might be a goal at some point in our lives.
Less is more, trust me.
Less is more here. And I love the fact that there's preventative, proactive things that we're hearing from the medical side as well to say, pay attention of the signs. And I think one thing that people also forget is that, screening and routine physicals save lives. Over the last few months in particular, I've had individuals that have actually told me that, I went and this is why I'm here today. So again, good advice from all of you today. As I'm watching the clock, and as we kind of near the end of our panel conversation, I'd like to just go one more time and see if you have any closing remarks you'd like to tell the audience today about, their health, the interconnectivity, and how you think are important points from this conversation.
So I'll jump right in. Make yourself number one. Put yourself top of the list. Start there, and then all good things will trickle down.
Wonderful.
And I'll share that you are the sum of your whole, which is the same thing as what Karen is saying. Put yourself first. You integrate all aspects of your life. You are not just a healthcare worker or something. You are the sum of all of that. So prioritize
Wonderful.
yourself.
Love it. Love it.
I would say that addressing stress is not admitting a defeat or weakness. It is being proactive so that you can do more for yourself, more for your family, more for your team. It's not weakness.
I love that. And so for our audience today, we've had some excellent panelists talking about different aspects of the physical and mental interconnection. And, we have contact information that'll be available post-conference if anybody wants to reach out to any of the experts here. And in some of it, we need to be taking count of where our health is and paying attention to the signs that may be telling us, time out, you need to be first for a few minutes. So again, thank you, panelists, for joining us today. I'm sure we'll have a lot more questions coming up after the conference that we'll be reaching out to get your expert opinion. So again, thank you. We're going to go briefly now to another quick break before we join our next session. So thank you all.